Meet WoundScribe's prescription engine. AI suggestions tuned to the wound, the diagnosis, allergies, renal function, and coverage. Every suggestion optimizes for three things at once: relevant to the wound, safe for the patient, and fillable on their insurance. Coverage tiers rank what the patient can actually pick up, with covered drugs floating to the top. Part 1. Finding the right drug for this specific patient. Open the Orders and RX tab, and WoundScribe has already surfaced a ranked set of medication chips matched to the encounter. For Dorothy, that's doxycycline and TMP-SMX marked covered, and clindamycin marked PA for prior auth. One click adds a chip to the prescription. Every suggestion carries a one-sentence rationale. Doxycycline covers EMSSA and CA and MARSA, is penicillin safe, and ties to her active diabetic foot ulcer diagnosis. On the right, WoundScribe shows what it weighed: wound status, penicillin allergy, active diagnoses, an eGFR of 48, care setting, and Medicare Part D coverage. Part 2. Keeping every prescription safe and fillable for this patient. Allergies are a hard limit. Cephalexin and amoxicillin clavulanate would be first line for cellulitis, but Dorothy's penicillin allergy drops them silently. And where a safe drug still needs caution, the rationale flags her eGFR of 48 and reminds you to monitor potassium with TMP-SMX. Covered Tier 1 generics lead, clindamycin is flagged for prior auth, and an expensive option like linezolid gets tucked under low priority. The legend keeps it readable. Green is on formulary, amber needs prior auth, red is likely not covered. Accept a suggestion, and the new prescription form opens already filled in. Medication, strength, route, dose, frequency, duration, quantity, and a complete SIG. Status stays as draft, so you review, edit anything you want, and then tap Create Prescription to commit it to the chart. And here's the result: doxycycline for the infection and topical mupirocin for the wound margin, both as draft prescriptions with full dosing and SIG. They stay as drafts for the provider to review, edit, or sign. AI Assistant supports the clinician. It never replaces clinical judgment. To recap, WoundScribe ties suggestions to the wound and diagnoses, treats allergies as hard limits, defaults to the safer option, ranks by coverage, and pre-fills the prescription, relevant, safe, and fillable, every time.